If you are over 50 and you drink plain water all day thinking it's helping your prostate, I need you to stay with me for the next minute. Because what I'm about to explain goes against the advice most men have followed for decades. As a urologist, I see men every week who are disciplined, hydrated, and doing everything right. Yet they're still waking up multiple times at night, dealing with urgency, weak flow, and pressure that slowly wears them down. This isn't because they're drinking too little water. It is because plain water alone no longer works the same way in the body after 50. And once you understand what changes, you'll see why adding one simple thing can completely shift how your prostate responds. This isn't about panic or embarrassment. It's about understanding what your body is doing differently as you age, so small issues don't quietly become bigger ones. Most men are never taught this. They were told to drink more water without being told how hydration actually works inside an aging male body. Urologists and men's health specialists talk about this every day, especially with men who say, "Doctor, I'm drinking plenty of water, so why is my prostate still acting up?" The answer usually surprises them. Hydration advice that worked in your 30s doesn't automatically work after 50 because your kidneys, bladder, hormones, and prostate no longer respond the same way. In this video, I'm going to walk you through why plain water alone can quietly make prostate symptoms worse after 50, what your prostate actually needs instead, and the simple adjustment men make that often leads to better flow, fewer night trips, and more comfort over time. And the final point is the one almost no one talks about. A lot of men start their day by chugging water first thing in the morning. It sounds healthy, and for younger bodies, it often is. But over time, especially after 50, the body's ability to retain and properly distribute fluids changes. When you drink plain water on an empty stomach, it can pass through your system too quickly, flushing out key electrolytes your prostate and bladder rely on for normal signaling. That's why some men notice they urinate more frequently even though they're hydrated. The prostate isn't being nourished, it's being irritated by constant pressure changes. Over time, this creates a cycle. The more urgency you feel, the more water you drink. The more plain water you drink, the more diluted your internal balance becomes. That's when men start waking up multiple times at night, not because their prostate suddenly grew overnight, but because fluid regulation has quietly shifted. Another common habit is sipping water continuously throughout the day without any structure. Many men keep a bottle nearby and sip every few minutes, believing constant hydration is protective. But without proper mineral balance, this keeps the bladder in a constant state of filling and emptying. For a sensitive prostate, that repeated pressure can worsen irritation. That's why some men feel relief when they change not how much they drink, but how they drink. Some men try to compensate by drinking less water in the evening. While this may reduce night trips slightly, it doesn't address the root issue. The problem isn't timing alone. It is how water interacts with the body's internal environment after 50. Restricting water can lead to thicker urine, which may irritate the bladder and prostate even more. Here's where most men get confused, and where misinformation online makes things worse. You'll hear extreme claims that water is bad, or that dehydration somehow shrinks the prostate. That's not true. The prostate needs proper hydration to stay comfortable. The issue is that hydration without support can backfire. Real prostate support is usually much simpler and much slower than what extreme claims suggest. It's about helping the body hold and use fluids properly, not flushing them straight through. If you're dealing with this, you're not alone. Most men experience changes in urinary patterns as they age, and many feel frustrated because they're trying to do the right thing. Understanding that this is a physiological shift, not a personal failure, is an important step. Supporting prostate health usually comes down to reducing inflammation, supporting circulation, and avoiding unnecessary pressure. Hydration plays a role in all three, but only when it's done correctly. One of the most overlooked factors is mineral balance. After 50, your kidneys become less efficient at conserving sodium, potassium, and magnesium. When you drink plain water without replacing these, the body struggles to maintain proper fluid balance. The prostate sits right in the middle of this system, and it feels the effects first. That's why many urologists suggest adding something simple to water, especially in the morning. Not a supplement, not a drug, but something the body already recognizes. When you add this, water is absorbed more slowly, tissues stay hydrated longer, and the bladder isn't triggered into constant emptying. Men often report that within weeks, they feel less urgency and more control. Not because anything was fixed, but because the system is being supported instead of stressed. Another overlooked issue is inflammation driven by repeated bladder contractions. When the bladder fills and empties too quickly, it sends signals through nerves that pass near the prostate. Over time, this can increase sensitivity and discomfort. Slowing that cycle helps calm the entire region. Some men also unknowingly worsen symptoms by pairing plain water with certain foods. High-sugar breakfasts or processed snacks pull water into the bloodstream quickly, then dump it into the bladder. That spike and crash effect is especially rough on the prostate. Small adjustments here can make hydration work for you instead of against you. It's also important to understand that prostate tissue doesn't respond well to extremes. Too little hydration leads to concentrated urine and irritation. Too much poorly balanced hydration leads to pressure and urgency. The goal is stability. Many men notice that when hydration improves, their sleep improves. Fewer night trips mean deeper rest, and deeper rest supports hormone balance. Testosterone regulation, inflammation control, and tissue repair all depend on quality sleep. This is why hydration strategy can affect vitality far beyond urination. Another thing rarely discussed is how stress hormones affect fluid balance. Chronic stress increases cortisol, which changes how the body handles sodium and water. Plain water during high-stress periods may not hydrate tissues the way you expect. Supporting hydration during these times becomes even more important. You may also notice changes in stream strength. That's often linked to bladder coordination rather than prostate size alone. When hydration is optimized, bladder muscles contract more effectively, reducing hesitation and dribbling. Some men worry that adding anything to water might raise blood pressure or cause swelling. That's why moderation matters. Small amounts, used consistently, tend to support balance rather than disrupt it. Extreme approaches are rarely helpful. As men age, circulation to the pelvic region also changes. Proper hydration supports blood flow, which supports tissue health. Without it, stiffness and discomfort become more common. Another overlooked factor is morning dehydration. Overnight, the body loses water through breathing and sweat. Drinking plain water immediately upon waking can shock the system. Adding support helps the body rehydrate gently instead of triggering urgency. This approach is not about quick fixes. It's about creating conditions where the prostate can calm down over time. Most improvements happen gradually, which is why patience matters. Men often ask how long it takes to notice changes. For some, it's weeks. For others, a few months. The key is consistency and understanding that prostate health is cumulative. It's also important to avoid stacking hydration mistakes. Drinking large volumes quickly, pairing water with caffeine, and ignoring mineral balance can undo progress. Speaking of caffeine, many men rely on coffee for energy, especially when sleep is disrupted by night urination. Caffeine increases urine production and bladder sensitivity. Supporting hydration earlier in the day can reduce reliance on stimulants. Alcohol has a similar effect. It dehydrates tissues while increasing urine output. Proper hydration strategy earlier in the day can reduce alcohol's impact later on. Movement also plays a role. Gentle walking improves circulation and fluid distribution. Sitting for long periods allows fluid to pool in the pelvic region, increasing pressure. Men who combine better hydration with light movement often report better comfort than those who rely on one change alone. Another important point is individual response. Bodies differ. What matters is paying attention to how your symptoms respond over time. There are no guarantees, and nothing here replaces medical advice. But understanding how hydration affects the prostate gives you more control over daily comfort. If you've tried everything else and felt stuck, this is often the missing piece. Not more water, better water use. Understanding your body is the first step toward feeling better long-term. Small changes, applied consistently, can have a meaningful impact on how your prostate behaves as you age. If you want more content focused on men's health as we age, you'll find it here.